Hello and welcome to the guest on CRTV News. As you all know, the coronavirus remains a great health threat to everyone. But to those already suffering from non-communicable diseases, the threat is doubled. And today our guest is the Secretary General of the Cameroon Non-Communicable Disease Alliance, and he is Ferdinand Senior. He's going to be telling us what the challenges people already suffering from non-communicable diseases go through during this pandemic and how they can better manage the crisis. Hello and welcome to the program.
Thank you very much.
Let me start by asking you what non-communicable diseases are.
So non-communicable diseases, simply defined, are diseases that cannot be transmitted from one person to another. COVID-19, which is the context within which we're discussing, is an example of a communicable disease. That means it can move from one person to another. But non-communicable diseases cannot move from one person to another. They are generally developed throughout one's life, through lifestyle, and through environmental factors. They affect the body. They're just developed. Non-communicable diseases, they have what we call risk factors. So there are 5 major risk factors for non-communicable diseases. We have unhealthy diets, which is the highest risk factor for non-communicable disease, what we eat. We have misuse of alcohol. We have physical inactivity. And then we have tobacco use. And the last one is pollution. But we also have things like stress that are implicated right now on non-communicable diseases. I'll not end in this definition without giving you good examples of what non-communicable diseases are. We have diabetes, which many people may know about. We have cancers, breast cancer, cervical cancer, liver cancer, colorectal cancer, different cancers. We also have hypertension, which many people also know about. There are many people in Cameroon with hypertension. About 3 million people have hypertension in Cameroon, estimated, with just about 14% who know they have hypertension, which means majority do not even know they have hypertension. Same with diabetes. 1 in 2 people who have diabetes don't know they have diabetes. That's how serious the threat of non-communicable diseases are in our community. So in Cameroon, for example, if you look at the annual deaths, if you count all the deaths that happen in Cameroon each year, 35% of those deaths are from non-communicable diseases. That's what non-communicable diseases are, and that's the burden of non-communicable diseases in Cameroon.
What is the link between COVID-19 and NCDs?
So when people started dying from COVID-19 in the Western world, in China and the Western world, it was later noticed that people who had pre-existing conditions were at risk of having more severe outcomes from contracting COVID-19. This means that when we talk about more severe outcomes, we're talking about very serious complications due to the virus, or even death. So if you look at most people who have died from COVID-19, majority are people with pre-existing conditions, including non-communicable diseases. Older people are also at risk, but older people, as people get older, they develop these diseases as well. So you see, non-communicable diseases are a very important aspect to consider in the COVID-19 response by all stakeholders who are responding to COVID-19.
While waiting for the stakeholders to make the move, and I think they're already doing so, but while waiting for them to do more, what advice do you have for these people themselves? What can they do to protect themselves?
First of all, I want to encourage people who have an NCD condition. And secondly, I want to also encourage them to not shy away from going to the health facility. Most health facilities they understand COVID-19 and are taking measures. And so if they themselves can observe the barrier measures that have been prescribed, like having your mask, safe distancing, washing your hands, and using your hand sanitizer frequently. All of those measures will assist them as they go to the hospital to continue their medication. But there's also another group of people it's important to advise. It's the healthcare professionals. They should help determine and ensure that services for people living with NCDs continue, even if it means imploring and utilizing and piloting telemedicine, additional other innovative means of reaching out to them, like home-based care or mobile clinics. There needs to be a lot of effort to be able to strengthen our health services so that it can address continuously the care towards people living with NCDs.
That brings us to the end of this exchange with you. Ferdinand Senior, you are the Secretary General of the Cameroon Non-Communicable Disease Alliance. Thanks for talking to CRTV News.
It's our pleasure. Thank you too for having us.
You're welcome. And that was our guest today on CRTV News. Thanks for watching.